Good afternoon, everybody. I'm Donald Clark. It's good to be back. And, we have a special guest today. We have Eric here from the Andrology department. Ooh, he's going to talk a little bit about what he does there. Last week, we had somebody from embryology, which was really awesome, and it answered a lot of questions. And today, we've got the other side. We've got the other side of the story, the other side of the coin, per se. And I hope you enjoy it. I know in the past we've talked a lot about men's health and sperm prep and things that men can do to ready their seed and create a better environment for their sperm cells. And everyone's been doing such a great job, and I'm happy about that. So today we're going to have Andrology come on and just chit chat about a few things that they think is important too, right? So the idea here, is to present to you a holistic approach, right? And the holistic means both sides, Western, Eastern, right in the middle, everything. It's all about creating a harmony. It's been a good week in upstate New York. It has been. We have torrential rains again, right? On my way into work this morning, I drove through multiple flooded areas, and and it's going to turn bitterly cold next week. So we should expect some heavy snow as well. And it's that time of year, right? Here come the holidays. I hope everyone's going to pace themselves and get ready. And some of the holidays are upon us now, right? And so happy holidays. So I'm going to introduce Eric. Thank you.
Thank you, Donald. Hello, everybody. Please forgive me. This is my first time ever doing this, so please forgive me for this. My name is Eric. I've been working at CNY Fertility Center for since 2006, and I've been dealing with andrology and endocrinology. More specifically, today we're going to probably talk more about andrology and basically what we do. Um, so we do four main components in andrology, most of which you probably already know. We do a semen analysis, a semen cryo, an IVF prep, or an IUI prep. And so within those four main categories, there are other smaller things that we do within those categories. But those are the ones you're probably most familiar with at this point in your journey. So a semen analysis. We know how important a semen analysis is and how important it is to keep up a semen analysis. We would like to see a semen analysis, obviously, for your consultation process, because it's going to tell us basically where the male factor portion of this journey is going to be. We always like to keep an updated semen analysis within your partner's journey. And we'd like to see one probably, within 6 months to a year, if possible. And it's important that all those information is given to us as far as consents, and all that information is given to us so we know exactly what to do when the time comes for your protocol. Semen cryopreservation is also something that we do here a lot. Most of you are familiar with that as well. But the semen cryopreservation process is used for many different reasons. Some are for either cancer treatments, other male factor issues and things like that. So it's a great useful tool for people who actually have issues collecting specimens and things like that. So it's always, you always want to keep that in the back of your mind when you're doing a semen cryo process, that you want to make sure that we have something here the day of your retrieval, and that we're not having to basically try to get the sperm here a day or two before your retrieval. So it's always great that your partner will come sometime before the process happens and schedule a schedule appointment for a semen cryopreservation. I know we get a lot of out-of-towners or out-of-staters, and sometimes it's really difficult to get here, but it's really, it's something that's very essential to us to have everything in place the day of your retrieval, and that way we're not having to deal with any issues as far as getting things expedited. So we have everything for you the day of, like I said, for the day of your retrieval. Consents, these things are very important. So make sure before you come in, you do your consultation process, and consents are given, and it's important for us to have those consents. That they're very helpful for us here in the laboratory. We can actually do things proactively before you even get here, which, with respect to donor sperm, IUIs, and things like that. If we have all those consents beforehand, we may be able to expedite your procedure for that day. So it kind of makes it a little bit more efficient as far as the laboratory side and the client side. So it's very important to make sure all the consents are up to date, as well as your semen analysis and all these other things are all up to date, so that we have the tools to help you achieve your goal. Um, IVF and IUI preparation is another common thing that you guys are doing here at the laboratory. Um, Now, IUIs, you can do a fresh IUI with a partner or a known donor. I'm sorry, excuse me, not known donor, but a fresh partner sperm. We also have a known donor program, and that's another program you can contact wonderful nurses here at CNY. Anonymous donor sperm, we also deal with that as well. We work with a lot of donor banks, and uh, you know, uh, with respect to donor sperm, if you're using that donor sperm route, it's always good to plan ahead. When you come in and you do your consultation process, it's good to start right away to really look at your donor and kind of really figure out what you want to do. And that way, you're not really waiting to the end or close to the day of your IUI or even retrieval, and everything's going to be set, and we'll have the sperm here and stored at the center that you're going to be doing your treatment at. So it's very important to get the, to look into really what you want, and then have everything ready. It's really really helpful for us in that matter. So IUI preps. We do fresh and frozen IUI preps, and it's a very common thing you see in the laboratory. We use basically a gradient system, and also now we are using a Zymot device. There are two different approaches to getting a final product when it comes to your IVF. Um, so the difference between the main two, for the Zymot device, because I know a lot of people are getting onto the Zymot thing, and the gradient system. So the gradient system has been around since like day one. It's a traditional gradient system where we put a raw semen sample on a gradient. We spin it down for a certain amount of minutes. We aliquot out the supernatant. We keep the little pellet at the bottom. Let's get the chosen sperm that we want to use. And then we do another light wash that helps with fine cleaning the specimen and getting it ready for ICSI or IUI. The Zymot device, on the other hand, is really helpful. People talk about DFI or DFI index and things like that. It's defragmentation. The Zymot device is more of like a swim up with procedure or a membrane procedure that is supposed to really not, defrag the sperm more if they have an index that's high, and it's supposed to be not as abrasive as contrasted to the gradient system. So I know a lot of people have been kind of inquiring about that as well. We currently don't do Zymot devices for IUI, only for IVF, just because we haven't gotten there yet as far as figuring out volume with respect to the IUI and the Zymot device. So right now we are currently offering the Zymot device that is available here at CNY. Again, going back to having everything in place, it's something you want to bring up with your nursing staff right away, and then get the ball rolling as far as purchasing one if you're interested, to make sure everything is secure, because there are some communications through different departments that really need to make sure everything's in place before we have that device ready for you. Let me see here. Let me see. Any questions here? Is there any way to collect semen at home and send to CNY? There is. So it's called an at-home semen collection kit. We do offer one here, and my personal take on it, and I think a lot of people in the laboratory, as far as embryology and andrology, is We do offer a home semen collection kit. You can get one if you want to, but I would recommend only really using that home collection kit, probably for last resort reasons. Unexpected events. Change in job situations or something like that. Um, you know, we would like to have something either frozen here at our facility before the retrieval, and we can do that well before your treatment here, or maybe go to another center and then make a freeze something there, and then make arrangements that come here. We just we tend to see the specimen not as good as we see with something obviously it's fresh, or if it's fresh and then frozen within a certain time frame. So is it doable? Yes, it is doable. But like I said, we would recommend that we go more of a fresh route, or a frozen at another center, or come here and make an appointment and fly in. I know a lot of you guys are from out of state, and it's a pain in the butt to get here. Sometimes it's understandable, but in this journey, we want the best that we can offer you. That's our job as here in CMY Fertility Center. And sometimes those specimens, they just tend to be, it's a little risky, especially in the wintertime when the temperatures are very cold. It can tend to be risky. And sometimes, people, clients want to get on it while they're in stimulation, and it kind of gets close to that cutoff time. It can give you a little bit of risk to it. But if you do need one for whatever reason, I know this is life, things come up. So I totally understand. You contact us. We can send that home collection kit out to you if needed. Um, it's definitely another option for you. So I totally understand how things can go. Another thing that we do is it's more some endocrinology. Um, Endocrinology is, but the most exciting to talk about. But CMY Fertility Center, we love your blood. We draw your blood. We're like vampires here when it comes to the blood. I just want to give you an idea of what some of that blood is, where it's going. So depending on where you're at and your treatments here, like say a consultation process. So a consultation process in the beginning, we'll have some of that blood is going to stay here. We do all of our reproductives in-house. So it's very helpful to the center, and it's helpful to our clinical staff, because we get those results right away. That way they can give you the phone call right away, and make necessary adjustments to your protocol. Um, a lot of the other blood that you draw, all the other tubes and stuff, do go to LabCorp or other centers, and they go ahead. We reference that out, and what they'll do is they'll run their specimens there, and then go ahead and send us back the results within a certain time frame. So a lot of those results won't really be as quick as some of your in-house bloods, which would be, like I said, most of the reproductives, and some of your more protocol bloods, um, and things like that. So sometimes clients call regarding, some of the genetic testing with the maternity stuff, and sometimes that stuff takes a little bit longer. And now with the pandemic really kind of setting in, it's kind of settling down a bit. We're kind of catching up with that as far as the laboratory side, the reference laboratory side. So I just, bear with us when it comes to the maternity stuff, and some of the pathologies and things that we send out. Um, let's see here. Semen analysis, 13 million, 9% motility. What do you recommend for treatments and supplements? So it's a good question. Well, you know, it's general health. There's a lot of things we can do. We need to, healthcare starts with you, and starts, with me. Uh, we need to, take care of ourselves. All the stuff that, the people tell you about, stay away from the drinking, smoking, recreational drug use. Let's, you know, get a nice diet going, not specific diet, just, something that's going to be healthy for you to, maybe lose some weight, kind of get some exercise. There are some, male supplements that you could take, like vitamins, multivitamins, depending on your situation. You can talk to one of our clinicians regarding what supplements to take that may help. But overall, general health and taking care of yourself is probably the best way. I mean, unfortunately, I don't know the history of this of your partner, but there are so many factors that play into why we have male factor, right? So we got health, we got environmental, we've got other, genetic components to it. So depending on where you're at in those three different categories, you can try to figure out, ask the doctors. Obviously we have a urologist here that really deals with some more of the obstructive stuff, and then we have the nursing staff here that are really great when it comes to the other male factor issues as well. So but definitely, that's the only advice I could give you is just, there are a bunch of studies coming out. Even marijuana is a big thing right now, and it's starting to be legal in all these states. Well, they're showing even a slightest male factor issue, and if you have one, fud joint a day, a week, it's showing signs of up to 30 to 40% reduction in sperm. And so we're seeing, some certain trends too. I'm generalizing the study here, but back in the 1950s, the sperm counts were much higher. We're losing half of our sperm counts from this generation. So there is definitely something going on as far as maybe the food products or taking care of ourselves or something like that. But the best thing I could give advice is to improve your semen analysis, drink a lot of water, stay healthy, or try to, incorporate good whole foods, and then, basic health care for yourself. Let's see if we got anything else here. Let me take a drink of water here. Sorry. Okay. Is it possible to have an abnormal semen analysis and a year later have a normal one? Yes, it can, and that could be a bunch of different things too. So I would have to look into his chart. Some people, um, semen is very strange, and the reason why we need to update that semen analysis, I like every, some a year. I think we do a year here. If you haven't been here a year, so if you had like a child in the past with us, and then you come back, and then we just, it's been 2 years, and then you want to go ahead and do another treatment, we say get another semen analysis. I think every 6 months, if you're going to do some sort of treatment, because semen can fluctuate so much, and a lot of times we don't know if your partner has seen a general physician and he's new medications, antidepressants, any erectile dysfunction medications, any hormonal therapies, um, you know any treatments for antibacterial. We've seen, I've seen people come in with, they had a fever that day, any increase in body temperature due to an infection, uh, that can make a semen analysis abnormal. And, he could come back a few weeks later and then collect a sample and be normal. So yes, I mean, it could be in your specific case. I may not know what's going on with your partner, but it can happen. I've seen it happen. I've seen recovery rates from cancer patients that have cancer and been treated with it. So uh, things can happen, and semen is very different. It's a very strange thing. You're not going to get every ejaculate isn't going to be the same. So if your partner's at 20 million at 50% motility in this perimeters, it's not going to always be like that. There's a cycle that goes on. Like I said, there's also other factors like your health, your environmental, recreational use, foods, drinking, hypertension, type 2 diabetes. All these things do come into play over time as you get older, or if things change. But I have seen abnormal semen analysis become either borderline normal or normal over time, depending on it. Like I said, depending on the treatments that they're on. Sometimes we treat our clients with some certain therapies if they've been, external testosterone use and things like that. So it can happen. Let's say, can a 45-year-old conceive a natural? That one, I don't know. I'm pretty sure they could. um, in your case, I would definitely talk to the doctors here. You know, that's what our job is to do. You know, our job is to help people of advanced age to help to conceive. Um, but I hope you enjoyed this. I just wanted to come on here really quickly, and if there's any questions, please feel free to contact us here at CMY Fertility Center. Um, the only thing I can really touch up on again is, you know, the day of your consultation, try to work on the paperwork and get it in on time. So a lot of times we got to get some stuff in before you're starting your actual treatments, your actual day of retrieval and things like that. And sometimes it can catch up to us a little bit. Let me see here. Uh, let's see. Metformin, you know, give us a call. You know, definitely. That's we've seen treatments with metformin, so I would definitely inquire it. Call us here at CMY Fertility Center. I am not a physician, so I don't want to give out too much medical advice regarding medications. But yes, give us a call. You know, any concerns, you know, get a consultation in here if you haven't had one. You know, any questions, we have a global team that's always on, you know, ready to answer some questions. If they can't specifically answer any questions, they can direct us to the andrology lab, and we can also try to answer some of those questions as well. But all right, any other questions? No, I think that's pretty much it. Yeah, so I thank you very much for having me. It's my first time on. Maybe I'll come on again. Remember, take care of yourself. Your partner's got to take care of themselves. We all got to, you know, the healthier we are, you know, the healthier it's, the easier it's going to make our job a little bit easier to help you conceive. So thank you very, very much. I appreciate it, and I don't know if Donald, you want to come back on?
Thank you.
All right, yeah, no problem.
Yay.
All right.
Yay. That was awesome. That was awesome.
Well, thank you.
You're great. He's
Thank
great.
you. Thank you.
He's great. I hope you enjoyed it. Again, I'm always blown away at how much about some things I don't know, right? I mean, I know a lot about a lot, but when it gets specific like that, that's where, you know, the expertise come in and the experts.
Thank you.
Have a great week and enjoy your weekend. And thanks for tuning in. And we're going to get back to some fundamental Chinese medicine aspects here on our next Facebook Live. Awesome. Thank you. Good day.